So as I said, thanks so much for inviting me to be here with you this morning. As Phil said, I'm Stephanie Pasternak, Senior Manager at State Affairs on NAMI National's policy team, which basically means I bug people like Phil on a regular basis at all the NAMI state organizations, but hope I also provide a lot of support and guidance to them with all their state policy questions and NAMI's policy positions. And so in this conversation, I'm going to share a brief overview of 988, what it is, who should use it, why we need it, what's needed for 988 to be effective. I'd also like to hold some time for discussing questions and ideas. So I'm going to try to finish up by around 11:45, maybe earlier, so we can talk. And I'll be perfectly honest, I'm not a great multitasker. So I will do my best to monitor the chat, but if there's any questions that come up during the presentation that are really pressing, feel free to just unmute yourself, interrupt me, shout it out so we can address it, or I'm happy to answer questions at the end as well. So I wanted to first begin by sharing some harrowing reminders of what it costs to have an inadequate crisis care system like we do today. Today, people experiencing a mental health crisis are more likely to encounter law enforcement than they are a mental health professional. And as a result, that people with mental illness and their families experience trauma and tragedy. Between 2015 and 2020, 1 in 4 fatal shootings by police were people experiencing mental illness, and of those, 1 in 3 were people of color. Over 2 million times each year, people with serious mental illness are booked into our nation's jails, and the rates at which people are dying by suicide and drug overdoses is wholly unacceptable. Now, I know you've all seen these headlines or some like them. For example, in February, police in Rochester, New York, handcuffed and pepper sprayed a 9-year-old girl experiencing a mental health crisis. Last September, police in Salt Lake City shot and wounded a 13-year-old boy with autism spectrum disorder after his mother called 911 for help, saying he was having a mental breakdown. A mental health crisis should not end in tragedy or trauma. NAMI believes that people deserve help, not handcuffs. Unfortunately, there's a real opportunity to change the status quo for crisis response, and it starts with 988. So what is 988? 988 is a 3-digit crisis line number for people in a mental health, substance use, or suicidal crisis that is going to go live across the country by July 2022. 988 was formally established last year by the Federal Communications Commission, or FCC. Then 988 was ingrained into federal law through the National Suicide Hotline Designation Act that was signed into law in October 2020. While 988 is a number for a crisis line network, it also will form the foundation for a reimagined crisis systems across the country that provide a mental health response to mental health crises. And that's why we kind of refer to 988 as not just a number, but a system. And just a big disclaimer, 988, as you heard, it's not yet live. So anyone in serious emotional distress or having a suicidal crisis should continue to call the national 10-digit number, 1-800-273-8255 until July 2022. So as you heard from the statistics, dialing 911 in a mental health crisis can result in unimaginable heartache, lasting trauma. 988 will be an option for anyone who's experiencing suicidal thoughts, signs of a mental health emergency like delusions, paranoia, mania. And we're also hoping too that 988 will serve people experiencing substance use related crisis as well. And one thing to note here about 988, sometimes people are confused and hear 988 and that it's replacing the 10-digit lifeline number, and it is doing that, but it's not simple a one-for-one replacement. 988 is also taking on an expanded scope of calls. Right now, the lifeline is primarily marketed as suicide prevention, but as you can see from what's listed here with 988, It's meant to be much more all-encompassing to address all mental health related crises. So how is 988 going to work? Well, the federal law required that 988 calls be routed through the existing National Suicide Prevention Lifeline that throughout the presentation I'll just refer to as Lifeline for short. And so some of the basics of how that works will stay the same under 988, in that instead of calling a 10-digit number, they'll call 988. There'll be an auto prompt where they can identify as a veteran and choose to talk to the Veterans Crisis Line if they want, or press 2 and talk to a subnetwork of Spanish-speaking call centers. If they don't press either of those prompts, you are routed to a local call center based on your location. And the local call center should take your call, but if too much time passes, then the local call center does not pick up, then there's a national backup center that picks up those calls. The 988 will stay, 24/7, free and confidential. To give you some perspective on the volume of calls the current Lifeline deals with, in 2018, they answered 2.2 million calls and over 100,000 crisis online chats. But what we hope will be different with 988 is that we'll see expanded chat options, that we'll see text to 988 options. NAMI is actually going to publicly comment on text to 988 to the FCC in the near future, understanding that having the text option is really important for a lot of people, especially younger people and people with certain disabilities. And the biggest change is you're going to see a greater integration of the call center with actual crisis response services. 988 centers should have a much greater service dispatch capability, meaning they can send out a mobile crisis team to someone who needs more support than can be provided over the phone. There's also some interesting local impacts from designating this number. There will be a new dialing procedure for areas of the country that currently use 7-digit dialing and have 988 as those first 3 numbers in their 7-digit phone number. And that actually includes parts of New Jersey. So you might have heard about this. If you're in area code 856 or 908, you will need to transition to 10-digit dialing. But we think that's a pretty small, that 10-digit dialing is a small price to pay for a nationwide mental health crisis network. And I certainly hope you agree with that. I'm also getting a little bit of background noise. So I'm not sure if folks want to mute. Thank you. Also with this easy to remember number, condensing from 10 digits down to 3, call volume is really expected to increase to 988 over the current Lifeline. The current operator of the Lifeline is called Vibrant Emotional Health, and they're expecting call volume to double or even triple in certain areas. Some perspective on New Jersey and the Lifeline right now. In the first 6 months of 2020, New Jersey had 20,961 callers to the Lifeline. Of those 20,000 callers, 84 were able to actually receive help in New Jersey. So a local call center picked up the call. But that means that 3,383 calls were not answered locally and had to be picked up by the national backup centers. So that 84% in-state pickup rate is actually pretty good. I've seen a lot of states set themselves the goal with 988 of reaching an 80% in-state pickup rate. And some of that might be due to the fact that New Jersey already has 5 local crisis call centers. Some states only have 1 call center that's in the Lifeline network currently. So what do I mean when I say that 988 should be a system and not just a number? Well, the designation of 988 is coming on the heels of some great work federally to build consensus on what the ideal crisis response system should look like based on some of the best practices from across the country. And so this was actually culminated at the end of 2020 into a toolkit that SAMHSA, which is the federal agency in charge of pretty much all of the federal mental health and substance use programs, they offered states a blueprint for creating an ideal crisis response system. And in short, that report recommends that every community offer 3 key elements. someone to talk to, crisis call centers, someone to respond, mobile crisis teams, and a place to go, crisis stabilization programs. It is important to keep in mind that the ultimate goal of 988 is to stabilize someone in crisis, no matter what that takes. We know the vast majority of people will be able to have their needs met over the phone, but we want to make sure that mobile crisis and crisis stabilization is also there to help people who may have more serious needs. So here's a summary of kind of the 3 core components or pillars of an ideal crisis response system, and I want to dive in one by one with these. So state or local 988 call centers. They should have well-trained staff and be available through the phone, text, or chat. They should serve as hubs that have strong connections with other emergency systems like 911, other information and referral systems too. And they should have built relationships with local mental health and substance use provider networks. They should be able to dispatch mobile crisis teams and ensure connections to other services, including crisis stabilization. And as I mentioned, most data right now points to the fact that folks are estimating about 90% of all calls to 988 will be able to be resolved over the phone. That next part of the model is mobile crisis response teams, teams that travel to an individual experiencing a crisis and provide an assessment, more stabilization, and may help the individual into a higher level of care if that's appropriate. Mobile crisis teams are an essential pillar of the system, as people who are experiencing severe symptoms of mental illness or substance use disorders often sometimes do need an in-person response. And communities are also increasingly looking at having these mobile crisis teams staffed by mental health professionals, including peers. So people who have lived experience of mental illness and have received training in how to help others. In several states, successful mental health mobile crisis teams rely on law enforcement for backup support in less than 5% of their calls in total. Connecticut and other states also have networks of children's mobile crisis teams, and as the tragic police responses in Rochester and Salt Lake City demonstrated, having some specialized children's mobile crisis teams are also desperately needed. The third pillar of the system is crisis stabilization. So crisis stabilization can refer to multiple options. An increasingly common option is a crisis stabilization unit that is in a living room-like setting and provides observation and initial stabilization to help someone for under 24 hours. These units also provide a warm handoff to follow-up care, whether that's peer support, outpatient appointments, more intensive services like if inpatient hospitalization is needed, or crisis residential care. And finally, these centers should have a sort of a no wrong door approach that allows public safety officers to drop someone off and leave within minutes, unlike now where you might have a police officer take someone to an ER and be forced to wait with them for several hours until they're seen. And this kind of gives you the feel. This image is a crisis stabilization center in Arizona. And you can see how it feels more like on the living room side, a little less of a hospital feel than an ER. And that's really what the living room model is about. So nationwide, what do crisis services look like today? Well, to put it really plainly, it's a patchwork, it's fragmented. Lifeline providers are trained primarily to take suicide prevention calls, and they have very limited resources to keep up with their current call volume. There's no consistent expectation of what you're going to receive when you reach out for help. There's no consistent number for crisis services. So if you're out of state and you can't reach out to your local crisis line, you won't know who to call. Of course, 988 will help with that. And we continue also to see law enforcement being put in the position of being the default frontline response, which is certainly not the job that they signed up to do. But some have said, 988 is going to be really a once in a generation chance to change the status quo in crisis care and create a fundamental shift in how we respond to mental health crises. And At the end of the day, we just want to make sure that mental health crises get a mental health response. And this issue is incredibly intersectional with many of NAMI's priorities, including helping people get the best treatment possible. Quality crisis response means that people are treated with dignity and respect, are responded to quickly and given rapid access to treatment, and other supports, including peer supports. Keeping people with mental illness out of the justice system. We want to see trained behavioral health personnel as the primary responders to mental health crises with limited interactions with law enforcement. Help people stay in the community and connected to services. So after a crisis, there should be a warm handoff to community-based treatment and other providers, and also a follow-up, from 988 to make sure that that person has indeed stabilized. Reduce health disparities for people with mental health conditions. A quality crisis response means less trauma for the individual, for the family, fewer negative outcomes like unnecessary hospitalizations, arrests, incarceration, an equitable response and access to treatment regardless of who you are or where you live. So regardless of race, ethnicity, faith, location, urban, rural, what language you speak, gender identity, sexual orientation, and much more. We want folks to get an equitable response. And 988 is also an opportunity to provide more culturally relevant responses to individuals and meet them really where they are. And this is not on the list, but I would just also point out, 988 is also a key opportunity to show, for NAMI to show what it can do in advocacy, to really be an agent of change and system-wide change. So how did we get here? In August 2019, the FCC issued a report recommending 988. There had been talks at state level and federal level for several years about the need to have a more accessible mental health crisis number, and they landed on the digits 988. In August 2019, the National Suicide Hotline Designation Act was introduced, and that spelled out that 988 was for both suicidal and mental health crises. It reimagined crisis response to include not just the call centers, but mobile crisis outreach and crisis stabilization. And importantly, the federal law declared that states can impose a fee on phone bills to support and fund crisis call center staffing, crisis outreach, and crisis stabilization services, really reflecting kind of our evolving understanding of the core components of a crisis system. But I will talk more about those fees later. In July 2020, the FCC formally voted to designate 988, and that's what triggered the requirement for all major telephone carriers, your Verizons, your T-Mobiles, your AT&Ts, they will have to flip the switch on 988 in July 2022. And then in October of 2020, President Trump signed the National Suicide Hotline Designation Act into law. And I will say NAMI federally was very involved in getting this law passed and sitting down at the table with all of our major partners and the telecommunications industry. Some other federal work that we've had has been mostly focused on getting some federal funding resources to support state 988 systems. That included, there's an enhanced Medicaid funding opportunity to pay for mobile crisis teams. That was a part of the most recent COVID relief package called the American Rescue Plan. There is increased funding for crisis services with the Mental Health Block Grant. That's one of SAMHSA's largest programs that comes down to the state. NAMI fought for a 5% set aside that would go specifically to fund crisis services, but that's really a floor for states, not a ceiling. They can certainly spend more than that. And our federal work isn't over. In fiscal year 2022 appropriations, we're on the Hill asking for greater funding for the National Lifeline, additional crisis services funding, including we'd like to see the 5% set aside I just mentioned made permanent, so it'll be there year after year, but also doubled to a 10% set aside. And we also want to see some federal infrastructure to support coordination and like a sharing of best practices. So we all have a role across the Alliance to play in making the vision of 988 a reality. But I am going to focus on the role of the states for the rest of the presentation. And mostly because 988 policy has really shifted from the federal level into the state's arena now. So I'm going to focus on what NAMI state organizations can do and how you as an individual can support those efforts. So of course, many times when federal laws are passed, that's not the end. It really comes down to the states who have to follow through and implement and fill in all the details. And when it comes to healthcare, our federal legislation can only do so much because we do not have a nationalized healthcare system. A lot of it is defined state by state. But states like New Jersey have a huge opportunity to build off of the federal action we've seen. Federal action has created this opportunity for states to redesign their crisis response systems and also, provide the resources for it. As I said, the Federal Act authorized states to charge a fee on phone lines, and specifically those are allowed to cover the expenses of state and local governments, what they're expected to incur for the efficient and effective routing of calls, and also the provision of acute mental health services. But states are going to have to actually act to make sure that comprehensive crisis services are available on the other end of the phone when someone calls 988. So this is an important opportunity for states to bolster their Lifeline call center capacity, start expanding the availability of mobile crisis teams, and also better support and connect folks to crisis stabilization programs. And it's really a critical time for states to act because there's really a sense of urgency for states to be ready and also local communities to be ready by July 2022, the go live date for 988. And there are a few things that have helped with making this more urgent too. I think COVID-19 has increased mental health challenges nationwide and awareness of mental health challenges. And incidents like, the death of Daniel Prude in Rochester, and more recently, Patrick Warren in Texas at the hands of law enforcement have put a lot of attention on mental health and crisis response. And it's important that we take advantage of the spotlight and the energy policymakers have towards making sure we don't see any more of these tragedies. So what can New Jersey do? Number one, bring everyone to the table. 988 is going to be very complex. There is a short window to July 2022, but really redesigning the system is probably going to be a decade-long or longer effort. Making sure that everyone who is involved in crisis response as it is today, and will also be involved in the future response of crisis response, is at the table and sharing their experiences. And it's a good opportunity for NAMI organizations to think outside the box of allies. And we don't necessarily have to only work with other mental health advocacy organizations. There's a lot of organizations that are gonna look to the success, be invested in the success of 988. And that includes, social and racial equity organizations as well. And the states will really, and the other big thing beyond bringing everyone together is state legislation. The states that will be best prepared to respond to 988 if they pass legislation that includes monthly user fees on phone bills, defines what the crisis standard of care across the state will be, provides additional resources to support crisis services, and creates oversight, coordination, and reporting mechanisms to ensure that 988 has smooth implementation, and that there's also accountability for how the system is treating folks. So I don't know if any of you, I'm just curious, anyone, show of hands, knew that you pay a small fee on your phone bill for 911. That is actually how we fund 911 currently. I had no idea. Okay. More people than I thought. You all are smarter than me and actually look at the details of your phone bill. I certainly didn't know that was how we funded 911. But that funding stream brings a lot of stability to 911 and services. And we really want to see the same done for 988. So state user fees, as I said, they're really a modest fee surcharge on phone lines included with other fees and taxes. It's a dedicated funding stream that can solely support 988. It's really the first kind of federally authorized funding stream for mental health since the Affordable Care Act. And the important thing about funding 988 this way is that compared to state GRF, when there's an economic downturn, the fee revenue will keep coming in about the same level. It's not as vulnerable to state budget fluctuations like so many other funding sources are. In state legislation, we've seen 988 proposed fees range from as small as 8 cents to $1 per month. And again, the federal law was very clear that the fees can cover call center operations, and ideally we want to see non-billable mobile crisis team and crisis stabilization costs. So really, mobile crisis and crisis stabilization should be billed to insurance as much as it can, but we know that there's always non-billable costs involved, like such as travel and things about recruiting workforce that these flexible user fees can bring to the table. And also, it's also just a good move for states because this is what congressional intent really was. Congressional intent for authorizing the fees was Congress's way of saying, hey, we know crisis care is fragmented across the country. Here's a new funding source. Use this to fill in your system's gaps. Now you might be thinking, well, new fees are never popular. Why would states want to spend this money? Well, beyond it being the right thing to do and creating more effective care for folks, a fully funded crisis system can help states achieve huge fiscal benefits as well. There'll be fewer unnecessary ER visits and hospitalizations, reduce the instances of psychiatric boarding, which is when folks go to the ER and there is not actually a psychiatric bed available, so they are forced to wait hours, days, sometimes weeks, it's been reported, to actually find inpatient psychiatric care. It can prevent arrest and incarceration for people with mental illness and reduce reliance on law enforcement. So police can focus more on public safety. Okay, so here is a map. And so far we have seen 19 states introduce legislation related to the implementation of 988. No two bills have looked alike. That is because each state has a very different model for crisis care. There is a model state bill for implementing 988 developed by the National Association of State Mental Health Program Directors. So that's the association that represents your state's mental health director or commissioner, whatever their title is. And the model bill includes a user fee provision, which, as you might imagine, the telecommunications industry has been fighting and speaking up out against in these state level battles here. This map, I will say, is focused on states that have either enacted legislation or have legislation that is active and alive. So there are a few states that I left off, such as Montana, Idaho, and Kansas, because they did have bills, but they unfortunately ran out of time this session, and so are not active at the moment. And you can see we're really keeping track of a few different approaches to 988 legislation. 988 legislation that includes a user fee, that dark blue. Most recently, Nevada and Colorado joined the party with the user fees. NAMI Nevada, I should give them a quick shout out, was very instrumental in getting their legislation signed into law just a few weeks ago. We also have 988 legislation enacted that doesn't have user fees. I'll get into that more later. And there's 988 legislation to create a 988 study or a commission, kind of laying the groundwork for a more comprehensive bill later. And of course, you can see that New Jersey is on this list, and I will talk about New Jersey's legislation a little bit later. But the big picture underlying here is with the fast pace that 988 is rolling out, there's really a need to build broad awareness and support for funding state 988 crisis systems. So here's some trends of this major state activity to date. And they really fall into three camps. Bills that build a 988 infrastructure and include a user fee. And what do I mean by 988 infrastructure? Well, are the operational requirements for the call center and the crisis services spelled out? Is it spelled out who has oversight over 988 systems? And also, we've seen 988 funds be created. And 988 funds are important, fund with a capital F, to gather all of the federal and state and sometimes local funding related to 988 in one place and to protect it from diversion. I know we've seen with 911 fees in the past, but those have been diverted for non-911 spending purposes, and really trying to get ahead of that problem with 988. So as you can see, just a few highlights of the 988 bills that did include user fees. We have Washington State. Their user fee will start at 24 cents, last for a year, and then increases up to 40 cents. Nevada's, as I mentioned, that was most recently signed into law, has user fees, but those fees are capped at 35%. To give you kind of a sense of how much money these fees can bring in, off the top of my head, I know that Washington State, when they reach 40 cents and they're really at their full implementation, they'll get $45 million a year just from the fees. And again, these fees, so far I'm happy to report, all these fees that have been authorized have been for not just the call centers, but the continuum that we want to see. One of the points of pushback from telecommunications is trying to get the fees just to support the call centers. But we know that continuum is so desperately needed. So we want states to maintain maximum flexibility and also stay true to the spirit of the federal law. Some states have taken a slightly different approach, and they're doing 988 infrastructure bills. So again, still laying out what 988 call center and crisis services should look like, but they're going to pursue the fee later in their budget process. So that's a couple of examples of that is Indiana and Oregon right now. And we have had some states that set up a 988 infrastructure and don't pass a fee. So an example is Utah, but that doesn't mean that they haven't authorized spending in other ways. So Utah also has enacted legislation. And for example, one of the provisions of the law requires the state Medicaid program to look at new funding sources to support 988. And as I mentioned, also there's 988 studies. So looking for states to assess their current system and create recommendations for financing. Actually, New York just enacted the bill you see on the screen there in, I think, just last week. And their intent is to take the recommendations from their study and essentially put it directly into their mental health 2022 budget. So as you can see, there's several different ways to go about funding 988 in a different legislative formats. And let's spend a moment talking about New Jersey's 988 legislation. Some key highlights is it does include a user fee provision, and that fee very clearly covers the crisis line and the continuum of services. It outlines requirements and expectations for the 988 hotline center and the response services. It creates that 988 fund that I talked about to really protect any 988 fee revenue, and creates system oversight. So names the agency that's going to oversee the system, and requires annual report on 988's usage to the legislature, which is important for kind of quality monitoring and also any corrective action that might need to take place in the early days of 988. Okay, so now let's talk about what you can do as an individual to make 988 happen. Number one, support your state 988 campaign and engage locally. Some more specific examples of how you can get involved are respond to any respond and also promote any action alerts you see come in from NAMI New Jersey and NAMI's national office, because I know, like, as I said, we would still be covering or pursuing a lot of federal funds that are going to benefit New Jersey and the other states. And so keep your eyes peeled for alerts from NAMI New Jersey, but also from us. And you can sign up for our federal alerts at that link there if you're not already signed up. And I also just a note on action alerts are really only ever as strong as the network that you're activating. So I know federally, NAMI's office, we actually had a day of action in September of 2020 to support 988. And I'm sure some of you sent in messages and responded to our alert to let members of Congress know that the National Suicide Hotline Designation Act was a priority for passage. And that really added so much momentum for 988 that we saw it pass the following month. So that just kind of trying to illustrate to you that replying to those action alerts is so important and does make a difference. It only takes a couple minutes for each person to do that. And you can really trust your NAMI state organization to let you know when and how to make your voice heard to support New Jersey's 988 legislation. You can share your story with policymakers. This is something you can be doing now. You can be thinking to yourself, do I or someone I know have a story about crisis services that would really paint the picture for lawmakers and decision makers about how crisis care is working? And those stories should really focus on the challenges with crisis care, but also if there's any positive stories you can think of as things that went well. And I would say also, like, be solutions oriented when you're talking to decision makers. Is there anything that you can point to that's really working and could be expanded upon, maybe in a local city or town? You can raise awareness with the media. So that can be op-eds in newspapers or engagement on social media. I know we had a lot of engagement with our kind of call to action hashtag on Twitter for the federal bill was 988 can't wait. And I've seen some state organizations take that and run with it. And I certainly recommend that. Engaging community education. Is everyone that should know about 988 aware of it? NAMIs are going to play a key role in making sure members of the community actually know what 988 is and what they should expect from it. And you can also recruit others to the cause, as I talked about, finding both your traditional and non-traditional partners to come and voice their support for 988. And so what's most immediately next? So there are state planning work groups underway pretty much in every state from a grant provided by the Lifeline provider called Vibrant. And those state work groups are required to create a 988 implementation plan and share that by September of this year. And that will be very informative to, I think, a lot of states in terms of where they want to go with state legislation. SAMHSA will also release a report on what federal resources are needed to support 988 this summer, and that will certainly inform NAMI's federal advocacy. 988 state legislation continues to move in states with year-round legislatures, such as New Jersey, but most states right now are on a break or headed into a break. And we expect much more 988 legislation in 2022. I mean, our goal is to see all 50 states on the map I showed you moments ago pass legislation that really invests in 988. And I will just say, to kind of wrap things up, after decades of advocacy, we're really at a turning point. There is growing recognition of the inherent injustice of a law enforcement response to a mental health crisis. And importantly, there are real vehicles for that change and to provide the compassionate response people with mental illness deserve. And NAMI members have a unique opportunity to speak up and demand a mental health response to a mental health crisis. And with that, I'm happy to answer any questions, start the discussion. I'll open up the chat so I can see if there's any questions in there.